Welcome to Micromed Education, and today we'll discuss regarding infection control. In this infection control series, today's topic is HAI, that is hospital acquired infections. These are the infection that develops in a patient after 2 days of hospitalization. And in HAI surveillance, basically we check surveillance of the 4 different HAI that are catheter associated urinary tract infection, catheter-related bloodstream infection, ventilator-associated pneumonia or ventilator-associated event, surgical site infections. So first we'll discuss regarding CAUTI, that is catheter-associated UTI. For any HAI, one has to remember there should be a device criteria, clinical criteria or culture criteria. Basically it is mainly with the CAUTI and CRBSI. So device criteria, as mentioned in the definition, it should be more than 2 days. So the presence of a device. Here it is a urinary catheter. Clinical criteria. Basically, what are the symptoms of UTI? It's definitely fever, suprapubic tenderness, urgency, frequency or disorder. So presence of any one of these should be there. That comes in your clinical criteria. And culture criteria, as mentioned in other UTI criteria, like isolation of significant bacteriuria, that is more than 10 to the power 5 CFU per ml of a urinary pathogen from the urine sample. And here the sample has to be collected through a catheter that we have already discussed how to collect the sample in our specimen collection video. You can check it again. So this happens how to diagnose a CIUTI. But prevention is better than the cure. So what are the preventive measures to prevent the CAUTI? So there are 2 types of bundle care. That is, one is called insertion bundle and another is called maintenance bundle. In case of insertion bundle, first of all check whether your patient need to get an Foley's catheterization. Once it is done, it has to be inserted in through a proper sterile technique. Maintenance bundle care. So hand hygiene is very important for the prevention of hospital acquired infection. Follow 5 moments and do proper steps. Closed system is required. There should be an unobstructed flow. The catheter should not be nicked or kicked anywhere, and back should be below the bladder level. A perineal care should be applied, and daily one has to assess whether this patient requires continuous catheterization. As early possible, remove the catheter. Now CRBSI, that is catheter related bloodstream infection. So in this also the device criteria is presence of a catheter, that is central line catheter, within 42 hours. Clinical criteria. So basically it's a bloodstream infection. What are the symptoms of bloodstream infection or sepsis? So basically patient will have fever, chills, rigor, hypotension. In this, that should also be checked as it is line related. So the catheter site where it is placed, there should be either erythema, tenderness, swamps or swelling is one has to check. Now what are the microbiological culture criteria? In such cases, 2 blood culture has to be sent, one from the central line and another from the peripheral line. And the time to positivity, there should be a difference. The central line should flex more than 2 hours before. If you have any doubt regarding the sample collection, check again the sample collection video. Now, how one can prevent this CLABSI, that is a central line associated bloodstream infection. So first of all, select the proper site, which type of catheter will be used, peripheral, femoral line, interjugular line, which line. Through proper aseptic conditions, after hand hygiene, insert the central line, use semi-permeable dressings to check the exterior of the central line. So one can easily find whether there is any oozing or a warmth or redness is there. Perform hand hygiene whenever you handle the central line, scrub the hub, and just like for urinary catheter, check for the early assessment of the removal. Now we'll discuss ventilator associated event. So basically in this, first we'll assess stage 1, that is VAC, that is ventilator associated condition. So again, the device criteria, obviously 2 calendar days. Then in BAC, first you have to understand the oxygenation criteria because it is something called ventilator association. So there should be a baseline FiO2 and PEEP. So the baseline value should be there for 2 days. After that 2 days, a baseline value, whether it is an increase in PEEP, that is more than 20% or more than 3 centimeter of water of PEEP is increased, sorry, FiO2 more than 20% and more than 3 centimeter of PEEP is increased for is 2 days. Then this is considered as VAC. Now the second stage is IVAC. IVAC is I stands for infection, that is infection related ventilator associated complication. So the name suggests infection. So whenever there is infection, what are the signs and symptoms? The symptom would be definitely fever and the signs would be here hypothermia, leukocytosis, leukopenia. And as there is an infection, there is an antibiotic is required. So the new antimicrobial agent should be started in the patient and that should be continued for more than 4 days. So these are considered criteria for IVAC, the clinical criteria. Now in stage 3, that is PVAP. The PVAP suggests you a possible ventilator associated pneumonia. The culture criteria in this are isolation of significant count of pneumonial pathogen from the respiratory specimen like bronchoalveolar lavage, tracheal aspirate or etc. How can prevent this ventilator associated event? Hand hygiene is must in each and every case. To prevent ventilator associated event, gear up the head at more than 30 degree, oral care with 2% chlorhexidine, avoid over sedations, give ulcer and DVT prophylaxis, breathing circuit should be maintained, cough pressure should be optimum, regular subglottic suction should be there, and check for the early weaning of the ventilator. Now the fourth one is SSI, that is surgical site infection. Now understand, any infection that happens after the surgery at the surgical site within 30 days of surgery or within 90 days in case of breast, cardiac or joint surgery. So which are the types of SSI? Either it is superficial, deep or organ specific. Name suggests its explanation. Superficial matlab it involves the superficial incision site like skin and subcutaneous. Deep, it involves the deeper level like muscle or fascia. And organ space means the infection is at the organ space site. Now, what are the NHSN criteria? Here, there is no device, so there will be no device criteria. However, there are clinical criteria. So, what are the clinical criteria? If there is a surgical site, presence of a pus from a surgical site or pain, tenderness, swelling, erythema. Culture criteria, that is a discharge or pus that has to be sent in microbiology laboratory and grow the pathogen. And the other evidence like superficial SSI is based on surgeon's diagnosis, and for deep and organ space SSI can be confirmed by imaging, gross anatomical space evidence or from the histopathological. So how one can prevent the SSI? So there should be first safe operating room, SAP, that is a surgical antimicrobial prophylaxis. Students, one has to remember that, and this is very important thing, the surgical antimicrobial prophylaxis is only for 60 minutes or 120 minutes before the incision. Mostly it is 60 minutes and the generally recommended antibiotics are either cefazolin or cefuroxime. Shingle swab. This is mainly for the clean surgery or clean contaminated surgery. It should not be prolonged for 2 or 3 days. It is for a single dose. A surgical hand disinfection, surgical scrubbing should be there, that we have already discussed in our hand hygiene topic. Surgical site preparation, chlorhexidine with the chlorhexidine antiseptic solutions, perioperative maintenance of oxygen, temperature, blood glucose level, normovolemia, as well as the nutritional support of the patient is very important. The other important features to prevent SSI like post-operative is wound dressing should be with the proper aseptic techniques. OT disinfection, that is performed with the high level disinfectant in between the cases or after the last one. Periodic monitoring of the air quality of the operation theatre, and as discussed earlier, the surgical antimicrobial prophylaxis should not be prolonged even there is a presence of a drain. Thank you so much.